Hi, and welcome to our program where week on week we connect you with some of the best IVF experts across the country. Now, we've been talking about IVF and fertility and reproductive health for weeks, but today we want to talk about something which is pertinent, especially for couples, who try for a pregnancy naturally for years altogether, and keep IVF as the last resort. If you've been tuning in, age plays a very important role when it comes to IVF success. So delaying IVF, keeping it as the last option, isn't always the best idea. To talk about who needs IVF, when, what are your options after traditional IVF fails, we have with us Dr. Sudip Basu, who is an IVF and infertility specialist with 21 years of experience. He is a gynecologist and the medical director, Srishti Clinic in Kolkata. Thank you, Dr. Basu, for joining us today.
Thank you, Megha.
So who is eligible for IVF? Who is this treatment made for? Who does it cater to?
Okay, you started with a very interesting questions that who is eligible for IVF. I think you have to look at the patient or the couple first, and you also look at the history and also clinical examination and findings. Now, all these things actually will guide you that what is the best infertility treatment for them. See, as infertility treatment, we don't have many options. Okay, as you understand, at the end of the day, you need an embryo to implant in the uterus. Now, how the embryo is formed? Embryo is formed by the egg and the sperm. So, it's the egg oocyte we call and the sperm. So, 50% genetic material will come from each other and give a good embryo, which will have the potential to implant in the uterus.
Hmm.
Now, for that, the egg need to be good, the sperm need to be good, the embryo need to be good, and the uterus need to be good. And if all this is okay, only then you can expect there is a possibility of pregnancy test positive. And when you do the scan, you might find out a good pregnancy sac with a baby with the heartbeat inside ticking. And if the pregnancy continues further, you have a healthy baby. Now, for this, anytime if any of these factors has got a problem, then you have to sort out the problem. So if there is a significant sperm problem which you cannot correct with the medicine, then at the end of the day, what you have to do? You have to literally do something to get a good embryo. And then
Hmm.
the questions of the IVF comes.
Hmm.
Because suppose a patient has got few million sperms, you are happy to look at the numbers only. But
Hmm.
all of these sperms are immotile, they're not moving, or all the sperms is almost close to abnormal, then actually you are having very few sperms which is capable of fertilizing the egg. Now, in a normal process, you know very well that with these sperm results, the woman is not going to get pregnant. So what you have to do, you have to resort to IVF or ICSI, intracytoplasmic sperm injection, where literally you have to put the sperm inside the egg with a special needle under the microscope. So in those patients, you need IVF. If a patient has got a problem with ovulations, you
Hmm.
have given medicines, he's not ovulating. You have
Hmm.
to increase the dose, and you're hardly getting follicles. You have to collect those eggs. If the patient has got a very bad oocyte quality, if the patient is getting elderly and she has tried almost all the avenues and everything has been found to be unsuccessful, then
Hmm.
as a last resort, you have to go for the IVF. So it all depends that what is the situations. So whenever the patient comes to me and asks, Doctor, do I need IVF? First, you have to look at the couple history, all the investigation which has been done, which is relevant. You might have to repeat some investigations, including a ultrasound, we call it transvaginal scan, and then you decide that whether this patient needs a very advanced infertility treatment. In infertility, we
Hmm.
have got only three options. Three. So What are those three options? The first is called ovulation induction and time intercourse.
Hmm.
Very simple. You give the medicine, the follicle grows bigger. You know the egg resides in the follicle. You check it out with the ultrasound. When the patient have the ovulation, you tell them, you go and have intercourse. And why? There's a reason behind it. Because when the egg comes out from the ovary, it usually survives 2 days to 3 days.
Hmm.
And when the sperm goes inside the vagina, usually the sperm survives 3 to 4 days. So
Hmm.
within this time of the ovulation, they have to do intercourse. Suppose the husband works in the army and once comes in a 6 months and then do the sex infrequently and then come to me, doctor, my wife is not pregnant and we are married for 4 years. That is not equivalent to they are having the intercourse for 4 years. No, because
Yeah.
probably you'll find out they have done the intercourse 3 or 4 times in a whole 4 years. Next is the IUI, intrauterine insemination. Is almost same. You
Hmm.
try to get 1 or 2 follicles in the ovary,
Hmm.
the good size, which probably will tell the egg inside is good quality, though not necessarily all the time. And then the husbands give the sperm to us by masturbation. We wash the sperms, get it very concentrated, very good quality sperms concentrations. And with a very fine catheter, we put the sperm inside the uterus. So basically, the sperm starts a journey slightly ahead. Okay, so they have got advantage in the marathon run, and you
Hmm.
expect the sperms will go and attack the egg in the fallopian tube, and they'll fertilize. So this is
Hmm.
the second option. The ovulation induction time intercourse only gives the success up to 10%.
Hmm.
In IUI, it gives success around 15%.
Hmm.
And the last option is IVF or test tube baby, where you collect the egg from the ovary, you collect the sperm, you fertilize it, get the embryo, and put back the embryo. And
Hmm.
that gives the 60%, 50 to 60% success rate if everything is fine. So
Hmm.
you have got only these three options. So
Hmm.
whenever the patient comes, you counsel them and find out which group they will fit in. So I hope
Hmm.
I answered the question.
No, sir, absolutely. And this is very interesting what you've, spoken about. You've told us about the stats of these three treatments available. And clearly IVF has that advantage of having better success rates. But there is also a lot of apprehension when it comes to IVF. So to sort of dispel that, I would want to ask that what other advantages IVF has over, IUI or ovulation induced timed intercourse. What are the other benefits of this treatment over others?
Okay, the ovulation inductions and IUI,
Hmm.
obviously you can repeat and the cost is minimal.
Hmm.
The IVF, whatever you do, if you use the standard medicine, if you use a good lab, if you use a good clinician and a good embryologist, it is a costly business. There's no
Yeah.
doubt about that. So it is very difficult for the couple to spend money for 3, 4, 5 IVF cycles. The biggest problem is that suppose they have scrambled the money for the IVF,
Hmm.
automatically it will cross their mind. Dr.
Hmm.
Sir ne bola tha, he told the success is 50 to 60%. I am going to be that 50 to 60%.
Hmm.
I am not going to fail. Okay,
Yeah.
because doctor told everything is okay. So it completely wiped out from their mind that I already told them that 40% don't get the success. So
Yeah.
whenever the pregnancy test comes as negative, the first question happens that why didn't happen? Okay.
Hmm.
Now you understand this that see, you can create the embryos. Okay, fantastic. You have done a good job. But you cannot force the uterus to hang on to that embryo. That
Yeah.
is the biggest tragedy or the mystery. The day we solve that problem, the success is going to be 100%.
Hmm.
What happens when the embryo goes inside the uterus? We
Hmm.
call it a embryo endometrium crosstalk. Endometrium is a bed where the embryo gets implanted. The
Hmm.
endometrium is the inner lining of the uterus. So
Hmm.
as soon as it goes in, there is a crosstalk, or definitely they do not talk to each other. What
Yeah.
happens? There is a change of the molecules. There is a change of electrolytes. There is change of leukotrienes. There is change of different cells called killer cells, suppressor cells. All these things is a very complex environment. If it works out well, only then the embryo is going to be implanted. If it fails, you do not know where it gone wrong.
Yeah.
So the people try to find out, but till now it is not successful to pinpoint to
Hmm.
exact problem. That's why
Hmm.
the IVF, the counseling is very important. And counseling is difficult too. Because a common person, they don't give a hell that about the endometrium embryo crosstalk, it looks very
Yeah.
funny and it looks very good on the newspaper and these things. But they want a pregnancy,
They want
nothing else.
success.
Absolutely nothing else. So the problem is, if the government would spend the money or they would sponsor her, they'll tell, okay, no problem. First time is failed, we'll go for a second because they're not paying the money from that pocket. And in Europe and even in UK, the many hospitals and trusts, even the government spends money for 2 to 3 IVF cycles. So it is easy for them to get a good pregnancy rate. Now,
Hmm.
usually it is told in our science, the second IVF cycle gives a better success than the first IVF. The
Hmm.
reason is very simple. The first IVF is a trial and error. You find out which medicine is going to work, why the endometrium or the lining was not so good, what happened wrong with the sperms. So second IVF cycle is try to rectify that. But unfortunately, many patients, they do not or cannot afford the second cycle. So obviously, the total number of the success is compromised.
Hmm. So, IVF has always been considered the last resort, something that couples will consider after they've tried for years altogether, they failed. But from what I understand, that age plays a very important role when it comes to IVF success. So, is this really a good practice? When should couples actually go seek fertility help?
No, you hit the bull's eye. Why? I tell you that. Uh, Being an infertility consultant in India and doing practice every day, it is very frustrating for us. Why I tell you that all the gynecologists, and with due respect to all the gynecologists, they always write down the infertility consultant. Okay, so you will always find out the gynecologist write down, the obstetrician write down high risk pregnancy, infertility, laparoscopic surgery. So whatever all the specialties they write down under the name. Now there's nothing wrong with that unless they exactly know what they're doing. The biggest problem what happens, especially what happens in the district, that first they don't do the ultrasound themselves. The ultrasound is done by the ultrasonologist. Now,
Hmm.
ultrasonologist who is doing the scan from top to bottom and doing the scan for 50 patients in 1 hour, it is impossible for them to understand that what is the nitty-gritty problem going on in the uterus and ovaries.
Hmm. Hmm.
So many times the result what is written down in the report card and when we do the scan, we do not agree. Very simple example I can give you to that. They never give that what is the ovarian reserve. That means the patient is coming for the scan, how many follicles are there, because it is an indication how much time they have got.
Hmm.
Just giving the ovarian volume or just giving the ovarian diameter is not going to solve the problem.
Yeah.
Because suppose they come to me and find out the right ovary has got 2 follicles and left ovary has got 1 follicle, I know that even if I give the best medicine to them and I go for IVF, probably I'll get maximum 3 to 4 follicles.
Yeah.
So I am already going to have compromised results.
Hmm.
Now, whenever the patient goes to a consultant in the district with the faith that they are going to have the right treatment, what happens? They get a blanket treatment of the medicine, which is going to do the growth of the follicle and ovulation. Now, in a patient who has got suppose 20 follicles, her response is going to be different from somebody who has got 3 follicles. The
Yeah.
patient even goes for 6 cycles of ovulation induction time intercourse who has got good number of ovarian follicles. Still, there will be some follicles left for which she can go to IUI or can go to IVF. But
Hmm.
who has got only 3 to 4 follicles, by the time she completes all the courses of the ovulation induction time intercourse and come to us, there's absolutely no egg. So when I explain to them, listen, your blood test report and also the ultrasound is showing that you don't have any follicles, they just cannot believe. And the first question will come to their mind, then why my previous doctor treated me for last 5 years? So infertility, as I told you, that is very simple, provided you understand the subject. There's
Hmm.
only three treatment available, but you have to find out which patient will fit for the particular group.
Yeah.
And that is the biggest problem, the time, which
Hmm.
the women do not understand. And I think probably in future, some people will come and give you the expression that in women, the biological clock is all the time ticking. Now,
Yeah.
in men is also ticking, okay, no doubt, but you will find out a 60-year man still fathers a child because there's millions of sperms. But you'll never hear a 60-year-old woman is being
Hmm.
pregnant naturally because there's no eggs left.
Yeah.
So for the women, the biological clock is ticking faster than the men, and you're losing eggs, more eggs every month.
Hmm.
And that is the biggest problem, that at 31, 32, they're married, they wanted a child, they started the treatment after 1 year, they went to the doctor, saw the doctor 1 year, changed the other doctor to another one. They gone
Hmm.
to the South India, which is a very train from Calcutta to go to South India, with all due respect to go there, come back.
Hmm.
So when after 6 years they come back to us when she's 38, you do not expect the same result is going to happen when she was
Yeah.
32.
Yeah.
So for the women, the age is one of the most important predominant factor to
Hmm.
define fertility. Now recently we are seeing a trend, and I'm very worried about that. We are
Hmm.
seeing lots of young women is
Hmm.
approaching menopause very quickly. That means I see lots of women who is 31, 32, 33, and there's hardly any eggs. And I have never seen this trend in Europe or UK. And it
Hmm.
is a very worrying fact. I do not know whether it's because of the stress, it's because of the anxiety, it is because of the pollution,
Hmm.
because of the heavy metal contamination of the food, contaminants, I do not know. But nobody, no scientist is looking into this matter. Why lots of women is going to be almost menopausal at the age of 30, 31, 32. And it
Hmm.
is worrying because very recently there is a report came out in Times of India that the
Hmm.
fertility rate in Calcutta one of the lowest in the metro in whole India. So that
Wow.
means forget about what used to happen. My grandmother had
Hmm.
16 children,
Hmm.
okay, and she didn't even try hard. Every year she used to get pregnant naturally. There are normal contraceptions.
Hmm.
Nowadays, you see, where is the infertility going? Why there's so many IVF units coming up? It
Hmm.
is such a huge problem, and unfortunately, that is not on the priority list of the government or even the insurance company. They're telling, "Arey, our country is suffering from population explosion." But my argument is that my neighbor has got 3 children. Does it give any satisfaction to me if I don't have any child? The answer is
Yeah.
no. And the number of infertility couples is increasing day by day.
Hmm.
It is
Hmm.
unbelievable at the moment. So that is the key point you told. Yes, age and biological age is
Hmm.
very important for the women.
So, sir, what happens when IVF fails for a couple? What other options can medical science offer, if there are any, to these couples?
Okay. Um, Now, obviously, see, any infertility treatment is a huge psychological journey
Yeah.
for both the husband and the wife. And it is very absorbing, very traumatic if it fails. If it fails even after ovulation, induction, time intercourse, if it fails after IUI, and more so after IVF, because the huge amount of money is involved. So the people wait when the blood test or the pregnancy test will be done, and if it comes as negative, that expectation takes a huge drop,
Yeah.
and it's very difficult to come out from that depressive phase. Okay. Now, ideally, the one IVF should not be the answer. Even the patient has been pregnant after 4 to 5 IVF. Okay.
Hmm.
Now, if after each IVF failure, what we do a counseling sessions with the patients. That called
Mm.
IVF failure counseling.
Mm.
Now, when the IVF failure counseling happens, we actually consult the couple along with embryologist and psychological counselor,
Mm.
and we try to go through the whole note from their first visit to find out whether I can pinpoint a problem which can be responsible for the IVF failure.
Mm.
And we write it down, and we try to learn from our mistakes if we have done any mistakes and to rectify in the next cycle. Now, even then, if the suppose egg quality is very poor, embryo
Mm.
quality is poor because of the egg quality is poor, or
Yeah.
we didn't collect many eggs, then the possible solution would be probably to go for egg donor program.
Mm.
If the problem with the sperms, very recently today actually I talked to a patient. This patient is coming for the egg donor program because her wife hasn't got any eggs.
Mm.
So, with a very reluctant mind, she agreed or he agreed for the egg donor program. Now,
Mm.
unfortunately, the husband's sperm is abysmal. So, what is happening? Every time I'm collecting the eggs from the donor and trying to fertilize with his sperms, it is fertilizing. After 2 days, there is an embryo arrest. So, it's not growing further. So, I know if I put these embryos, she's never going to get pregnant. So not
Mm.
only the wife suffers from a significant problem, the husband also have a huge problem. So I
Mm.
tried 3 times and then found exactly same thing is happening. So I had to call them and told, see, probably the best option to go for donor embryo. So it is unfortunate that the whole 100% genetic material from outside. But if you
Yeah.
want to make your wife pregnant, and if we try with your sperm, it's not going to work. Same thing whenever suppose there is a problem with the uterus. Uterus is deformed because of adenomyosis. There is a
Mm.
huge fibroids. Then you have to sort out this problem. And if you cannot sort out the problem, you have to go for surrogacy. Now the
Mm.
surrogacy law is very strict. It's not going to be extremely easy. So
Mm.
gradually what happens, all the doors are getting closed. And probably only door will be left out is adoptions. Now, obviously, the adoption is taken with a pinch of salt by the many couples. In Western countries, it's much more easier to be a foster parent or adoption. But initially, here in this country, the adoption is used to be a very nasty business. It used
Yeah.
to be controlled, uncontrolled, totally uncontrolled, and people used to make money out of it. I'm not talking about the doctors, I'm talking somebody outside the doctor's domain. But
Yeah.
nowadays, the Indian government has put it very streamlined. And you know, there's a Kolkata where there's a
Mm.
website, you can put your name, you put upload all the documents, and you can actually follow that how your name is coming up on the top of the list. The biggest
Mm.
problem is that the list is probably 3,000, 4,000, 5,000 is going a day. So
Yeah.
once the option comes, you'll get only one or two options to choose a child. And if the child has got a problem and you don't accept the child, you will go down again the list. So it
Mm.
is not going to give all the solutions, but at least government is trying to help these
Yeah.
infertile couples. Now, one thing is very interesting. I must end this particular conversation with this anecdote.
Mm-hmm.
When I used to work in Cardiff, assistant
Mm.
reproduction unit, and I started as a research fellow, and then the senior registrar and lecturer. And one day, I went there and find out there is a medical education program or seminar, and the positive outcome of a negative IVF cycle. So it crossed my mind: are these people nuts? That what is
Yeah.
the positive outcome of a negative IVF cycle? Everything is negative there. So how
Yeah.
we can even think about it? So with a bit of reluctance, I joined the crowd, and there's a
Mm.
lady called Australian lady who is actually a psychologist. Her name is Jackie Bovin. She has published lots of paper, and the way she analyzed that, see, before the IVF, sometimes what happens, the husband and wife under the doubt whether they should go through the process. And if the wife is responsible, sometimes the husband is very unhappy. I have to go through the IVF, I have to spend money. Why is happened to me? Or contradictory if it happens to the husband. So sometimes they go through the IVF with a very reluctance and no attachment to each other. which is for some couple, not for all of them. Even for those couple, after the IVF cycle, they found out they go through this difficult process together, and their love and affection and the relationship is renewed. And then they think, okay, why not another one? I think we can manage. So that is a fantastic revelation that sometimes when you challenged by the adverse event in the life, you actually take it a positive stride and you
Yeah.
try to gain confidence and learn from it. And I never looked at that from that perspective. And I have seen quite a few patients actually came down, doctor, we're very happy, we'll try, and if it doesn't happen, we are done, no problem. So their attitude has changed, and it is amazing. Even a negative IVF cycle can
Hmm.
actually help them to become stronger.
Positivity in adversity.
Absolutely, you're absolutely right.
So, sir, we've had a very interesting question from Udit, who asks, IVF procedure is very expensive and you cannot afford to do it multiple times. So, in your opinion, what is the one most important thing when it comes to helping chances of success?
It is the probably most difficult question you asked in the beginning. See, the important thing is that the clinicians should be honest, the transparent, should be properly skilled, along with a good set of embryologists and the good IVF lab. As I told you, that all the patients are not suitable for IVF, and IVF is not going to work for all of them. So, a clinician should be open to discuss if there is any problem, to discuss in details with the patient and to maintain the transparency. Unfortunately, that thing sometimes is lacking in our country. Why I tell you, sometimes I get the patient, okay, from the other unit.
Hmm.
As you expected, our success rate is 50 to 60%. Same thing happens that some patient who didn't get pregnant go to the other unit from my unit. So whenever they come to my unit, what you're supposed to do, you go through your notes, you find out that what is the ovarian reserve in the beginning, what is the sperm status, what medicine has been used, how many follicles has been developed, whether there is any problem with the egg collections, how many eggs have been retrieved, how many embryos have been formed, how many good quality embryos, how many day 5 blastocysts, how many transferred, where is the transfer was okay, was the blood test is negative completely or beta is positive, was it active like this? And unfortunately, believe me, you go through the pages and you hardly get any information. Okay. And it is very sad because, as I told you, that if there is some information, I could easily pick it up
Yeah.
and probably would not repeat the same mistake in the second IVF cycle.
Hmm.
So, what I believe that whatever the outcome, what I do, I write down everything in details because at the end of the day, as a doctor, what I want, this woman should get pregnant. It really doesn't matter she gets pregnant in my clinic or she gets pregnant in somewhere else. So if I can help even that aspect to giving the maximum information, I think it is my moral duty to do that. In UK, there is a authority called HFEA, Human Fertilization Embryology Authority. From time to time, they come down all the clinics and they go through all the notes. And if there's any discrepancy, they'll immediately close down that infertility unit. It doesn't matter what political affiliation you have got, what
Hmm.
influence you have got. They're so powerful. And
Yeah.
all these heads of the HFEA, they are not doctors. They are from the society, very renowned people. Unfortunately, we still could not do anything like that in our country. Okay. And that is why I should not say in the open forum, many things is done in the infertility world which probably is unwanted. This should not be done. So one of these things, the information should be shared. Even somebody fails and the patient asks me, the doc, should I go to another doctor? I write down my friend's name who are equally good or better than me. I tell you, go them, you try them, and I ring them. See, I could not help. Please help this woman. And this is the information I've got. And I think we should have this honesty and transparency. Only then the doctor-patient relationship even can be built. So for the IVF success is very, very important. It's very difficult to pinpoint one particular point, but
Hmm.
we need a good embryo and we need a good lining of the wall only then it is possible to get success.
So, sir, as we come to the end of our program, what I wanted to close with is to understand, in your opinion, what are the most important things that couples who are going in for fertility treatments, then be it IUI or IVF, what are the important things that they should know about?
So I think, see, it's very interesting that in Western countries, and as I told you, I worked for 12 years in UK, the people are never afraid to ask questions. I think they have got every right to ask questions. Here, they put the doctors on the pedestal and they're very scared to ask the questions in case the doctor becomes very angry and doesn't answer the question. I think this myth should be broken. What I do initially, I explain them about the physiology, that how the pregnancy happens. And you believe me, even after 6 years, 7 years of marriage, even have loads and loads of ovulation induction medicine, when they come to me and I explain them with a model, they first tell, oh, I didn't know the pregnancy happens like this way. So they have done the sex, they are married, they are a happily married couple, even do not know the time of ovulations, and they have to got a fertile window. So a little bit of knowledge about the physiology is very important, and
Hmm.
never scared to ask questions if you are not happy or you cannot understand. The doctors has got the responsibility to explain everything in their own language. If a patient comes from interior village and I speak everything in English, they will just sit there like a dumb doll and just will be very happy to leave my clinic. So I think the time has come to explain to the patient so that when they go to the other clinic, at least they know
Yeah.
that what should be done and why it has failed.
Yeah.
Because in our schooling or college, the sex education is a big no-no. Okay, you can watch blue movies, you can read blue magazine, you can do the gossip with your friends, but unfortunately, our teacher never explains about the ovulations or the sperm count or the fertile window, nothing. So basically, even the people who are getting married, they haven't got a clue apart from yes, we have to do sex, that how the women can get pregnant. So
Yeah.
these need to be changed. And if we do that, I think many women, even with the simplest procedure, will get pregnant.
Absolutely. I think that's a very important and interesting point that you've raised, that understanding your body, your own physiology is important if you want to get pregnant. And of course, asking questions to your doctor, not being scared and being open, building that trust.
Sure.
Well, thank you so much for your time today, Dr. Basu. It
Thank
has been
you.
an absolute pleasure, very insightful session. Thank you so much.
Thank you very much. Thank you. Take care. Bye bye.